morning and welcome to another beautiful day. My name is Gugu Eyala. You're watching Morning Spectrum here. Actually, the aspect of this program now, what we call Getting to Zero. Getting to Zero is a program that is geared towards sensitization and also helping the National Agency for Control of AIDS achieve the 2030 goal of zero new infections in HIVs in this country. I have here with me Dr. Azori Great. He is coming from the Center for Public Health Initiative. Population Initiative, and then together we're going to take a look at some of the issues in the HIV space. But before we go straight to start talking about that, last week we were here and we were talking about pre-exposure prophylaxis. After that program, I went to town and talked to some media people, and their response was quite surprising even to me. So we'll just give you the responses of some of these media practitioners, and then we'll come back and we'll discuss more about this program, more about this topic, HIV. Actually, this morning we'll be talking about the different ways, the different modes of contracting HIV. The ways that you can contract HIV. Well, we know that some people think they know all about that, but you'll be surprised to hear about new ways, other ways that you don't know about contracting HIV. But before that, let's take a look at what media people, what they said about, the new drug. Enjoy yourself.
Pre-exposure prophylaxis for HIV. What do you know about it?
I'm just hearing it for the first time.
Pre-exposure prophylaxis is a medicine that prevents HIV and AIDS.
Wow.
So what's your take on this?
Well, this is a very good development. At least it's like a cure. Is it like a cure?
No, it's not a cure.
Okay, preventive.
It's only for prevention, yes.
Okay. It's okay. It's a good one. It's a good one.
There is a new medicine called pre-exposure prophylaxis, which is coming in as part of the interventions on HIV. How much do you know about it?
For now, I have no idea, but I think whoever had produced it should be able to let the public know better.
Okay, according to the expert, pre-exposure prophylaxis is a medicine that, when taken, prevents the HIV transmission from an infected person to a non-infected person. So what's your take on this?
Well, I think it's a very nice product that has come to intervene in terms of HIV infection. But my problem is affordability and availability. If they are available and affordable, better for us.
So what's your suggestion to the providers, to health providers, to the government and other people concerning pre-exposure prophylaxis?
Now, definitely, I think since the government is concerned about the health of the citizens, I think they should be able to make this thing available. I still repeat, it must be available and affordable. Not just because you've heard the name, whatever, and then you come and say, okay, go and buy. Where will we buy? Is it from the counter? Is it from the hospital? Is it from specific units where we may say, okay, this is HIV hospital or wherever. So such a thing should be localized. If we are localizing it, that means everybody can now access it. If you can access it affordably, then you can now use it to prevent, since it does not cure. That I know by your explanation. Since it does not cure, it can prevent. So if they can localize by making it available in good quantity and affordable price, better for us.
Thank you, sir.
Good afternoon.
There is a new medicine for HIV and AIDS. It's called pre-exposure prophylaxis, short for PrEP. How much do you know about it?
I've not heard about that drug before.
Interesting. So PrEP is a medicine that, when taken, prevents infection from HIV. In other words, if an uninfected person takes it and this person comes in contact with somebody either through sex or any other means that has the HIV, the disease will not be transmitted to the person. So what's your take on this?
Well, I think it's actually a good improvement here in Nigeria, having such a drug that if at all somebody has it, it can prevent you from actually contracting the disease.
Good afternoon, sir.
Good afternoon.
So there is a new medicine in town, it is called Pre-Exposure Prophylaxis. Do you know about it?
I don't know anything about it. I've not heard, because I'm not a health practitioner, and I haven't heard. That's the simple truth.
Okay, many people say they've not heard about PrEP. Okay, PrEP simply means pre-exposure prophylaxis. It is one of the drugs used in the HIV intervention. While others are used for treatment, this particular drug is used to prevent the transmission of HIV and AIDS. So what's your take on this?
Well, it's quite commendable that aside getting drugs for the treatment of HIV, they also have the one that can prevent this disease from spreading. So we will call on the government to do everything possible to do more of conscientization of the citizenry, to be aware of this interventionist medicine, so that more people can have can get it and then prevent themselves as well.
There is a new medicine in town. It is in the HIV intervention. It is called pre-exposure prophylaxis, shortened for PrEP. How much do you know about this medicine?
I'm just hearing that for just now. I don't know anything about it, and I'm not sure there is any sensitization for people to know that there is something like this, a new drug to take care of HIV.
PrEP prevents the transmission of HIV from an infected person to a non-infected person. So what's your take on that?
It's a welcome development, knowing that people can now live normal life. The fear of HIV/AIDS being incurable will now be laid to rest somehow. Not total, but people will now know that you can, as well as, for the married ones, you can get pregnant even if your partner is positive. You can, with this new drug now, you can, get pregnant, get satisfaction in your marriage, and not get that fear, fear that if you try anything with your partner, you'll be a kind of life sentence to death. It will not be there. But one thing I am concerned about is, with this new development, this new drug, how accessible is it for people to get, these drugs? Where can they find them? And who are those in charge of this new development?
That
Actually, it's necessary for there to be a sensitization on it. There should be information out there, because just like it's a surprise to me, I'm sure there are some persons who have not heard about it.
So do you think that such a drug is going to encourage promiscuity in the society?
I think it will. I actually think it will, because people will want to always take advantage of situations. So I think it will, to an extent.
So some people think that it will increase promiscuity in the society. What is your opinion on that?
I don't think so. I don't think so, because if you know that there is a sickness or a disease such as HIV, HIV and AIDS, and because there is a preventive drugs, you feel you have to, do what you're not supposed to do, because that drug, it might fail. It might fail. So why don't you just keep yourself, instead of, okay, there's a preventive drug, let me the whatever, and then I can prevent myself with these drugs. No, I don't think it's going to really cause any harm.
You know, they say young people between the ages of 15 to 25, you know, and then men who sleep with men, and then also commercial sex workers and all that. They term them as the key population. You know, those are people that, you know, at high risk of contracting HIV and AIDS. Now, the people say that if PrEP is made available for everyone, that it is going to increase promiscuity, especially among this young population. What's your take on this?
So even without it, promiscuity is on an increase. Even without it. So, of course, you know, you said between the ages of 15 and 25. This age is known to be very sexually active, and also men and women who also indulge in illicit sex can also contract this disease. But whether PrEP is made available to the citizenry or not, promiscuity is always on an increase. Of course, most of our ladies have turned themselves into commercial sex workers in search of food and, of course, money and all of that. So, whether or not this medicine is made available, it does not affect who is in the commercial sex sexual market or something. But the most important thing is government should make this medicine available for the citizenry to have and to prevent themselves. It is better than not having it at all.
Thank you, sir.
Thank you.
We kind of are trying to find out how many people are aware that there is such a medicine, and how many people are making efforts to access it. So, what's your advice to SACA and other, even to NACA, that is National Agency for Control of AIDS, and to other agencies working in the HIV space?
Simple. My advice to all the agencies involved in HIV/AIDS prevention, they should try as much as possible to sensitize the populace. It is not fair that we have this new development, this new drug, and people, the populace, majority of the people, if not that you just mentioned it to me, I'm not even aware that there is this new development that will help the masses. But the only way to ensure that this drug gets to those who really need it is for those concerned, the agencies, to ensure that there is sensitization, proper sensitization to the grassroots, not just to the urban populace, but to the grassroots. Because here, it's in the urban centers, it's nothing to write home about. But when you get to the grassroots, that is when you know that HIV/AIDS is real. Even though some at the rural communities will tell you there is nothing like that. But if you go there, the story is pathetic. So if SACA, NACA and all the agencies involved will take it as a point of duty, including the NOA, that is a National Orientation Agency, to go to the rural communities and even put this on radio, put it on air for people to know, so that when we get informed, we get enlightened, we can tell the next person, please, this is what is on. There is a new development. HIV/AIDS is no more a death sentence because you can manage it with the new drug that is in town. Thank you.
All right, you're welcome back. You're still watching the Morning Spectrum here. You have this program every Thursday. We called it Getting to Zero, because that is the goal of NACA. We're trying to stop new infections, trying to completely stop new infections by the year 2030. But you need to know what's up. You need to know the interventions available. You need to know the medicines. You need to know what to do so that that you help NACA to achieve that goal. Once again, I have here Dr. Great here with me. Doc, you've seen the video,
yes,
you've listened to the people, the issues raised, many issues were raised, sensitivity about sensitization, where to access the drug, and the question of promiscuity and all that. You are the expert in this field now. What's your take on some of the things the people have said? What do you have to say, about that?
I think the clip is an eye opener that we need to do more in terms of awareness creation. So it just shows that a lot of people are not aware that the drug PrEP is actually out there. It's not entirely new, but it's heartbreaking that even the people that come in contact with information on a regular basis are not aware of this drug. So if you extrapolate it to the common man in the marketplace, then of course the awareness is very poor. So I think we need to do more. But again, that's the advantage of this opportunity, of this kind of collaboration, for us to increase the awareness of people that that should be aware of the drug and what we have there. Is the drug available 100%? It's available. Is it accessible 100%? It's accessible. Then where can we get the drug? I think one, you can actually come to our facility. Our facility is at number 15 Omeredu Street, very close to Salvation Ministry. Number 15 is free, is accessible, is available. Then I'm also aware that in most of the general hospitals and primary health centers, and even in teaching hospitals, the drug is available there. You can actually access it there. Again, like some of them said, I'm not the drug would not increase promiscuity, because it's already on the rise. Like somebody said, it's already, the people are already sexually active, but the drug will help us prevent the spread of HIV infection. If you look at the 1.4%, the number looks small, like you said last week, but if you compare it to our total population, it's alarming.
Even last week I made a mistake in my math. Actually, the 1.4% is I want to extrapolate it to 2%. It shouldn't be 2 million, it should be 4 million.
4 million. Yes. And that's a huge number for us. Considering our health system, how not too strong our health system is, and considering the fact that the drug is the U.S. government that is supporting us in acquiring this medication. So again, you should realize that we should declare state of emergency. Considering the numbers we are now seeing now in terms of the new infection in Rivers, Bayelsa, Akwa Ibom, and all those other states, believe you me, we should declare state of emergency.
So Dr. Great here has confirmed that in his facility at number 15 Omeredu Street, JRA Phase 2, Port Harcourt, it is available. So if you're able to get there, you get it for free. Now, the question somebody asked is, how about the market women? How about the traders? How would they know about this medicine? And then how would they access it? As as an agency working in this environment, what do you think can be done so that these people can also have the benefit of accessing this drug?
I think it's to do more media engagement like this. It's to create more awareness and more sensitization. But as several things are going through my mind, maybe we need to do an engagement with Market Women Association, if there's an association like that, so that we can actually go to the marketplace and create awareness on HIV and the ways to prevent it. So we work on different levels of engagement, and we also encourage other radio and TV stations to also create time for this kind of discussion. You understand? Because I think it's one way to assess everybody at the same time. So we work on such engagement to ensure the information should be there. So people should be aware. Let it be that I want to make the choice to either be on the drug or not.
Hello.
Hello, good morning, sir.
Yeah, good morning. You're welcome. Your name and where you're calling from, please.
My name is Glory.
All right, Glory, go ahead.
This trust.
Yes.
It's prevention, right?
Yes, it's for prevention.
Okay, but how can we get it? Is it for free? How much is it sold? And how can we get it? Where are we supposed to get it?
It is completely free, and you can get it from, first of all, at the River State Agency for Control of AIDS. That one is at William Jumbo Street. You know, you can get it. And then also, at this, my guest, Dr. Great, said you can get it at his own facility, number 15 Omerolu Street, you know, at GRA Phase 2, close to Salvation Ministries. You know, you can also get it there for free.
All right, sir. Can this address be texted as a message? Is it possible?
15 Omerolu Street.
Sir.
Yes, the address. You want it to be texted to you as a message.
Yes, sir.
Okay, what you will do is you text to us that at least I need the address, and then we'll reply you.
Okay, sir.
Thank you.
And I think married woman that does not trust her husband can also take it.
Yes, if you think that your husband has multiple partners, you know, he has other women he's sleeping with, it's good. Yes, you can take it to prevent yourself from getting HIV.
Thank you, sir. This drug, is it supposed to be taken when you want to meet your spouse, or you take it at any time?
Okay, I think when you go to the facility, you'll be counseled, you'll be told how to take the medicine. However, the doctor is here and he knows more. I'm just a presenter, so he can advise.
So it's a daily drug, you take it daily.
Okay, like this combination 3, the way you take it, is this something like that?
You take it like every other drug you take on a daily basis. So if you start the medication, you take it Monday, you take it Tuesday, take it Wednesday, continuously.
Then how many cards are you supposed to take? Are you supposed to be taking it, or as soon as you are through with one card,
no, so
you are free forever?
No, as long as you are at risk, as long as the risk is still there, you continue taking it.
As long as you, madam, sorry, as long as you fear that your husband can, can infect you, you keep taking the medicine until you don't have that fear anymore. Until you think that the problem is over, then you can stop taking the medicine.
And a serious assignment.
Okay. Is there? Don't worry.
Very much.
Thank you.
I enjoy the program anyway.
Yeah, you're welcome.
I just wish our government would continue this way and truly make the provision available for both the poor. Because know that tomorrow now you will go, they will start telling you, fill this form, pay a little of money, compensate us and all that. What we are hearing now is very interesting, but when we get to a place where we will get it, it will be a different story. Nigeria. So I just pray this time Nigeria can just behave straight or sincere once for this. Thank you very much.
Thank you, madam. Thanks for calling in. Don't worry. At 15 Omerolu Street, it is free. I can guarantee that one.
Very free. You will not pay anything.
You will not pay anything. Okay. We'll take another caller. Hello, good morning.
Hello, sir.
Yeah, good morning, sir. Your name and where you calling from?
I'm Ikenna Mother. Ikenna Mother calling from Onoku.
Okay. Ikenna, you're welcome.
Okay, sir. Now, each time we talk about this HIV, people's mind will go straight to specialty course.
Yeah.
I'm asking, we have other people say we have other ways of people
contracting the disease. Yes.
And we are talking about commercial sexual workers here and there. How about other areas where people contract HIV? Are they not expected to take care to get the preventive measure you are talking about right now? It only meant for only folks who do special intercourse.
Okay, thank you so much for your question. Actually, if you were listening to us, today actually we're supposed to talk about the different modes of contracting HIV, and it's not only through sex, but unfortunately, or should I say fortunately, we discovered that a lot of people don't know about the PrEP, the prevention. So we spent the time talking about it. Next week, we shall be addressing the different modes of contracting HIV and AIDS, and then your question will be properly addressed. I hope that you will tune in next week. The time is 8:45 a.m. to 9:30, and we'll talk about that. All right. Thank you so much. Doc, our time is fast spent, and actually we're supposed to be rounding up now. So, what do you have to say, basically, before we close shop this morning?
I think we need to do more in awareness creation. It's not enough for us to know about HIV. We also need to know how to prevent it.
Yeah.
Prevention is key, so we need to do more in creating the awareness. I think it's for me, it's a take-home assignment to see what we can do as an agency to create that awareness, to see how we can collaborate with several stakeholders to ensure the information is there and everybody can access it.
All right. Thanks so much for coming around.
Thank you very much.
And you out there, thanks for watching. Once again, my name is Gugu Iyala. Remember, the goal is 0 new infection by the year 2030. So try to take some prevention, so that you don't add to the HIV burden of the country, because we want 0 new infection. Next week by this time, actually next week by 8:30, immediately after the news update, the program will be here again, and then we'll be talking about modes of contracting HIV and AIDS. So be part of the program, and we appreciate your being there. Thanks. Stay tuned for more programs coming to you from RSTV. Bye-bye for now.